Hello, my name is Debbie. I'm the senior surgery nurse at Cave Veterinary Specialists, and I've just got a few words to say about my COVID experience. So obviously during the lockdown period we stopped seeing routine consultations and just saw cases that were necessary to see, so the real emergencies, and it's been really good over that time to be able to develop my emergency and critical care nursing skills. These are very rewarding cases to deal with. I think the lockdown conditions themselves meant we were fairly limited with our staff in each day, and this really did put a lot of pressure on the team, but in a good way. We responded really well and we've all pulled together, and I feel like we've become a much more close-knit team. We've really supported each other, and although the days have kind of felt really stressful at times, it's been really nice to have that support amongst our colleagues. I think that for myself, I am particularly interested in interpersonal skills and how people relate to each other, and it's been really good over this period of time to see the team really coming together, to be able to use my own interpersonal skills to get on with team members that I don't usually work with, that during these conditions we've ended up working together. I think we certainly are generally a closer team now. One of the experiences that I can think of that really encapsulates this whole COVID period is when one of our own staff members, whose dog had been hospitalised with us for a few days, needed to be put to sleep. She came with her husband and her father-in-law, and unfortunately, because of the lockdown conditions, we couldn't let them into the practice. The dog was under anaesthetic, so we couldn't bring the dog out to them. So our staff member came in, said goodbye to her dog, and it was quite distressing to see her upset, not be able to give her a hug, and know that her loved ones were outside waiting for her. They couldn't say goodbye to the dog, and they couldn't be with her in her moment of grief, and it really struck home how people must be feeling in this period when their family members end up in hospital and they can't go in to see them. So it really did sort of strike home at that time what this whole pandemic's been about. I think pet owners on the whole have been really understanding. There have been long delays for some of them just because of the pressure of work and our capacity at work, but they have been really understanding, and I guess you can see that they're worried for their pets, but with the added stress of the strangeness of the COVID time, they've really come through and been supportive of us as a veterinary practice when we've been treating their pets. So on the whole, I think it's been a real sort of learning curve for everyone, clients and staff, in terms of coming together and pulling together in this time.